So many of you have been in contact with us and calls, texts. I want Dr. White to just come up and just say a few words, tell us how we're doing. You're practicing social distances. We have our masks, and I think as a city, and I think we're doing better. He's going to tell us, give us a grade. He can give us a grade. We're glad to have medical professionals, members of this church. Amen. Thank you so much. So many medical professionals in this church, and Dr. White, one of our leading medical doctors in this city.
Good morning to all. Thank you, Pastor Swift, for again allowing me to speak to the group. COVID-19 is here, still here, and it continues to wreak havoc around the world. If you follow the numbers, Tuscaloosa, the state of Alabama is reporting over 120,000 cases to date. And compare that to China, the country where all of this started many months ago. China is still reporting somewhere around 90,000 cases. The county of Tuscaloosa is reporting like 5,200 cases today. And in our hospital at DCH, yesterday was like 49 positive cases in the hospital, and we have been as high as 109 cases in the hospital at one time. Fortunately, we're not, having all those increased numbers. There's numbers coming down in the hospital, and we are doing better. The number of deaths that have occurred in Tuscaloosa County is over 150, and 94 of them were related to residents of Tuscaloosa County. So just for those who think that, this thing is somewhere else and whatnot, it is here. It is still widespread in our community, meaning that we have had a patient from every zip code in our area, multiple cases from those areas, and it's not going down. We know that since the University of Alabama opened, there's been a lot of cases reported from the university campus, over 1,000 cases there. Fortunately, there are not many of those cases in that community who are being admitted to the hospital and being sick, but we know that the possibility for them taking it home to their parents, for the staff and people who are working in that community, they all have an increased risk of getting the infection. I participated in a school board meeting a couple of weeks ago where the city schools of Tuscaloosa is pondering with the idea for what they need to do, and they have guidelines from the CDC, they have guidelines from the state of Alabama, and they are trying to do their best to follow those guidelines, staggering students and doing all of that. I know we all want, for the benefit of our children, for children to be back in school, but if we don't follow the guidelines that are put out there for the safe distancing, the wearing of face covering and mask or so, and hand washing and all of that, it will be a challenge for the school system. So let's continue to pray for them, that they will make the right decisions, that those who are supporting them will do the right things. If they do the right things, it can work. As you see in our community, because our numbers are going down and trying to level off, is because we're doing all of this. So I encourage you, and if you do this, you have to do this correctly. A lot of time I see people, the mask is below the nose is hanging out, and the breathing and stuff. If you put it on and put it below your nose, then you're not doing it correct. It's just halfway, okay? And I also mentioned some time ago that people say, you wear the mask so you can protect, so you can't give it to other people. You wear the mask to protect yourself, too. You wear it to protect yourself. Don't think that, So, and a lot of times people can be asymptomatic. You don't know you have it. So you don't have to have fever and coughing and sneezing to think, I got it. You could be asymptomatic and transmit it. So please, folks, let's take this seriously. Lives are being lost, and we can do something. Like, if they tell you, say, if you wear your mask every day and practice all these things, you will save 50,000 lives. Goodness, if you save 10 lives, that's important. So please, let's continue to be serious about this. And Pastor, I'm so proud to see our congregation here following these recommendations, because I hear from around town other people, we don't do it at church, and we don't, it's just being too bold and selfish to think that you can run away from this virus here. So let's continue to be vigilant. Thank you, Pastor.